Welcome the opportunity to discuss the recently completed meta-analysis of patient satisfaction after laser eye surgery. Just to give you a little background, I was fortunate to be one of the original investigators of laser vision correction and have been performing this procedure for 13 years. Concurrently, I have a full-time academic practice specializing in cataract and refractive surgery as well as corneal transplantation at the Medical University of South Carolina, where I am a professor of ophthalmology and director of the McGill Vision Center. I am also a Lasik patient. Before I begin, it's appropriate for me to disclose that I consult with AMO, Alcon, and Bausch & Lomb, all companies which are manufacturers of excimer lasers used to perform LASIK. To avoid any appearance of conflict, this analysis of the studies I will discuss today was completed by my colleagues, research students and faculty, and resident physicians, none of whom work as consultants to any of the before-mentioned companies. I am here to represent the American Society of Cataract and Refractive Surgery, ASCRS, where I have served as the chairman of the FDA Liaison Committee for the past 4.5 years. The goal of this committee is, and has been, to facilitate communication between the FDA and ASCRS membership. I also serve as co-chair of the Joint LASIK Study Task Force. The ASCRS was contacted by the FDA in response to various inquiries the FDA received from LASIK patients. Although the FDA had already conducted a review of the medical literature finding the majority of patients were satisfied after their LASIK surgery, I was asked to perform an independent review of the world's literature regarding patient satisfaction or meta-analysis. The review of the world's literature demonstrates that greater than 95% of patients from around the world are satisfied after their LASIK eye surgery. This is amongst the highest percentage of patient satisfaction reported for any elective surgery. This review encompasses all articles from the inception of LASIK to the most recent articles published in 2008. First, all databases available online at the Medical University of South Carolina were searched using search terms to be inclusive of every article ever written about LASIK eye surgery since the inception of LASIK. 2,915 abstracts were identified, and each abstract was reviewed. 1,581 articles were pertinent. They were obtained, reviewed, and read, and based on the strength of the evidence, 309 articles were identified and entered into the database. These 309 articles represent peer-reviewed, well-performed prospective, retrospective, or case-controlled studies. These have all been published in major ophthalmic journals from all over the world. The locations of these studies also represent a global distribution. 19 of the 309 articles identified specifically addressed patient satisfaction and quality of life. These articles represent surgeries from 1995 to 2003 performed in 13 different countries, 7 of which were in the United States. The remaining 12 were performed in 12 different countries. As stated, the overall review of the world's literature shows the vast majority of patients are satisfied with their LASIK surgery, 95.4%. When further looking into these studies, no matter how the data was evaluated, the same 95% satisfaction rate still appears. There's the same level of satisfaction regardless of the type of prescription treated with LASIK, whether the surgery was at the inception of LASIK or the most recently published study for which we have data, whether the surgery was performed in the United States or elsewhere, whether validated questionnaires were used or not, whether questionnaires were administered anonymously or not, whether the questions were asked in the first 6 months or after the first 6 months and out as far as 5 years, the same conclusion exists. 95% satisfaction rate is consistent. In conclusion, this review of the world's literature has shown that the majority of patients are satisfied with their LASIK surgery and confirms the findings of the FDA. This study is meant to set a baseline of knowledge regarding patient satisfaction. As a physician, our goal is to improve the quality of patients' lives every day. That's why I get up every morning, excited to go to the office. It's why I chose this profession. However, no surgery is without risks, no surgery is perfect, and not every patient is a candidate for this surgery. It was with the goal of identifying and reducing these risks that this analysis was done. It is this goal that drives us to do more than just see and treat patients, but to be involved in task forces like this, to do research, to teach, to publish, and to consult. It's why we are here today. When a patient experiences a complication or is dissatisfied with the outcome of their LASIK surgery, it affects all of us. I'm confident that today's meeting will be a key step toward taking what is already a very successful procedure to an even higher level. Thank you very much for your time today.
Thank you. And just for clarification, I believe that the ASCRS independently decided to do this literature review, and there was no participation or request from either the FDA or the American Academy of Ophthalmology.
This was independent from the FDA or the National Eye Institute. Yes, ma'am.